This presentation is called Mapping the Body, Exploring HIV Through Art, and this group is for mothers with HIV. George Brock said that art is a wound turned into light. The purpose of this group is for women with HIV to support each other's vision of personal wellness through the use of body maps and weekly discussion of relevant topics. A little bit about body mapping. It is an art and narrative therapy, and initially it was used as an advocacy and educational tool to draw attention to HIV/AIDS in Africa. Its storytelling is used to put the journey of HIV/AIDS into words and images, and shortly we'll be watching a video, but one of the clients in the video says a quote that I'd like to bring your attention to. He says, "You put all your dirty stuff on that map and it comes out all washed away." And you can now view the video below.
HIV in women can lead to diminished activity tolerance, neurologic and cognitive changes, occupational and social role imbalance, and stigma and discrimination. And as group facilitators, we need to have an awareness of what people are bringing to the group. That women with HIV often carry shame from their status. Renee Brown studies shame and vulnerability, and she says that shame grows from three things: secrecy, silence, and judgment. So the body mapping is a way of giving voice to that shame. And we thought this picture by artist Keith Haring was very appropriate. It says, ignorance equals fear and silence equals death. So body mapping would be a way of combating that.
In our hour-long group session, we would spend 5 minutes doing the introduction, 20 minutes on the body mapping project itself, 30 minutes on the discussion, and 5 minutes on the wrap-up. We would use the psychodynamic and model of human occupation frames of references. Under the psychodynamic frame of reference, we would seek to bring unconscious conflicts to the conscious level so that these issues can be discussed and resolved. Under MOHO, occupation is viewed as an interaction between the person and the environment. Dysfunction in any one of the three human subsystems results in dysfunction of all, as they are interconnected. We would seek to address volition, habituation, and performance in order to enhance function.
In the first week, we'll talk about coping and stress reduction. Before these women can deal with any of the specific issues, they need to be able to deal with their stress, and they need to be able to cope. There's many stressors associated with HIV. Besides for the stress of just the diagnosis itself, it has a lot of implications. Family, for example, a partner leaving, community, there's a big stigma in some communities associated with HIV. Medication side effects could be debilitating, finances, etc. So first we would go around and have the women talk about how they cope and share their own strategies with each other. And then we would talk about two different specific strategies. One of them is MBSR, mindfulness-based stress reduction. And this strategy is a meditative approach that focuses on living in the present and approaching stressful problems and situations with a more thoughtful and less emotional approach. This has been shown in a specific study that I found, but also there's other research on it, that it can help alleviate the side effects of HIV, and it can help with other stressors as well. The second approach that we would talk about is yoga. There's a lot of research about yoga, and I found a study that shows that yoga can lower blood pressure in people with HIV, which is very good for managing stress. And yoga in general has a focusing, calming effect that can help people in the short term and the long term.
There are many symptoms associated with the diagnosis of HIV, both physical and psychological. The most common psychological symptoms are fear, anxiety, and depression. The most common physical symptoms are neuropathy, nausea, vomiting, and fatigue. In one large-scale study, the most effective treatments included basic activities such as walking, taking hot baths, aromatherapy, massage, and talking to others. We would encourage group members to discuss their symptoms and ways in which they manage them. We would also introduce discussion of other treatment modalities if the topics did not arise naturally. There are many medications that a person living with HIV must take in order to maintain a level of health. In one survey, 1/3 were unable to adhere fully to medication regimen. When the factors influencing adherence to medication regimens were examined, the biggest determinant was not literacy, it was not level of education, it was not the knowledge about effectiveness of medications. It was simply self-efficacy, or the perceived ability to carry out the behavior. This session would therefore address the ways in which to make the regimen more manageable in order to increase self-efficacy.
During week 5, the topic that will be discussed is sexuality, safety, and precautions. And the discussion will be based around that sexual intimacy is essential to well-being, and all human beings need to touch and be touched. So some of the topics that we'll cover in the group and we'll discuss amongst the women are the fear of loss of physical contact, nurturance, and sense of intimacy due to shame, pain, or fear of HIV transmission. We'll also discuss communication skills. So the women will learn how to have honest, informed, and safe discussions about desire, HIV, and transmission in order to fulfill their sexual intimacy desires. And we'll also discuss educational resources for the women. We'll use resources such as the World Health Organization, which puts out a pamphlet called Sexual and Reproductive Health of Women Living with HIV/AIDS, and we'll also use the CDC or the Center for Disease Control as a resource during this week's discussion.
After generalizing, we would focus on what can we take out of this group for real life? How can we apply it? We would focus on different points for application depending on which week and which topic we were focusing on. So the body scan, identifying where you're holding tension, that we could focus on during coping and stress management week. Some specific strategies that you can take out and use in real life that we could focus on during the financial management week. Some other points for application are what supports do you feel you need, how can you maintain the positive aspects that were discussed, and who is one person that you can call when you need support. At the end of the group, we would summarize what happened over the group session. So we would have them share our activity and the discussion. What was the discussion focused on? What did you learn that you can take home? Reiterate the goals and the process, how we got to those goals. Discuss the overall mood and what emotions surfaced during the session, and finally to thank everyone for participating.